Hi everyone, we are here to talk about chest tube insertions and nursing care associated with inserting a chest tube into a patient. So right here we have the chest tube cart, which is housed across from trauma A. So anytime that we have a patient that, whether it's a trauma patient or any other patient that comes in that requires a chest tube, you're going to want to refer to this cart here, and we'll go over what's in each drawer. In the first drawer, you have all of your chest tube accessories, and they are sort of collected nicely in a kit like this. So you're going to use this accessory kit. It has a scalpel, it has betadine, it has Vaseline dressing, it has IV catheters, everything that you're going to need for that type of emergent patient. And you're also going to use this accessory kit when you're inserting a chest tube for a less acute patient, if you will. In the second and third drawer, you have your actual tubes that you're going to be inserting into the patient. In the second drawer, you have your trocars in all of the appropriate sizes, along with sterile gloves. In the third drawer, you have your pigtail chest tubes and the accessories associated with that as well. Last but not least, you have two sterile chest tube kits that are going to be housed in the fourth drawer, and we're going to take one out and show you what's included and what to do.
So when this procedure is starting, surgery will all be sterile. You will have all of your stuff ready. Your suction will be set up, good to go. It'll be on high suction for your initial output. So always make sure that that is hooked up, since they will pass it to you as soon as the chest tube is in. So when they're opening this, they will be sterile. So you open this. So the water is on the top, it's in that bottle, and you'll go ahead and put that in the back chamber.
And you're just going to squeeze the entire thing in. You'll see that it's going to go down, and then the water itself is going to turn blue. So make sure that you squeeze this whole sterile water container, and then that becomes garbage.
If you're confused about which hole to put the sterile water in, it's the only hole that's circular on top. The other one is a rectangle. So this part will be hooked up to the patient. This is your 5-in-1 connector. You will go ahead and slide this blue level underneath the chest tube and set it on the ground. Make sure that it's below the patient, otherwise nothing will be draining. Once your patient is all connected, you'll hook them up to the suction. Again, it'll be on high suction, and it goes on the back on the circular part where you inserted the water. You'll immediately see some bubbling.
And then you'll also see the suction control indicator. I'll have to turn it up a little bit higher, yep. And you'll see this sort of bright red plunger indicate that you have appropriate suction. There also is the suction control is always set to 20 centimeters of mercury, or of water rather, and this is always going to be at 20, so if talk to your physicians and talk to your providers to see if that needs to change.
So I'm currently going to pretend that I'm the lung this is the chest tube inserted. So I'm using my hand and acting like I'm breathing. When you initially put the chest tube in, the output will fill, so make sure that you mark your output, especially with the initials, and then put your initials on there. When originally the chest tube is put in, you should see a little bit of bubbling with expiration for the patient. So it should go to the 1 or 2, and it will look like this. If you're trying to check for an air leak to see if that number has increased, you're gonna go ahead and detach the suction. And if the bubbling is continuing over, if we started out at 1, if it goes up to 5, then you know you have an air leak and you need to check all of your connections, where the sutures are, and they possibly might need another chest tube.
The other thing to note is that when the patient is hooked up to suction and the chest tube is appropriately connected to the patient, you're going to notice that there is there's a ball in here, and you're going to notice that there's going to be movement of the ball with inhalation and expiration. So when the patient inhales, going to move up, and then when the patient exhales, the ball is going to move down a little bit, and then you're going to see that water sort of fluctuate into this area as well. As Patty mentioned, if you notice that the water bubbles to the 4 or 5, you have to reassess the patient and evaluate for an air leak. When the patient is transferred, you want to Again, this is going to be below the level of the patient. You're going to remove the suction from the patient, and you're just going to leave this suction circular hole open. You don't need to cover it. You don't need to take portable suction with you. You're going to take the chest tube tray, or chest tube system rather, make sure it remains at the level of the patient, and you can roll the patient to wherever they're going with the hole uncovered. A lot of questions as to how much drainage is too much drainage. So if you notice that in this drainage compartment, you have a sudden large output with that initial connection of the chest tube, or you have greater than 3 milliliters per kilogram per hour for 3 consecutive hours, or you have greater than 5 milliliters per kilogram for 1 hour, you're going to have to reassess to see what's going on. This patient might be more critically ill than you first imagined.
There's also the fast fact sheet available if you're looking for more information. It's always by the charge desk, and then you can refer to this video as well.
Thank you.